popular trend that we've seen maybe over the last 2 or 3 years is we have more and more patients coming in asking to have their implants removed. Not that there's anything wrong with implants, they just getting to the point where maybe the pendulum is swinging back towards a more athletic look. So whether it's somebody who's had implants in for a year or 30 years, patients come in and say, what do I do now? I always tell them there's a few options. The simplest option is just to take them out, but that's the option where the patients come in really unhappy with the doctor. So while it is an option, it's not something that people choose. The reason is this: most people who chose to have implants didn't have much breast tissue. Then after several years of having an implant stretching out the skin that they have, the skin gets stretched, and then suddenly when the implant's removed, you have this loose, droopy skin. It's not a very pretty look. Very few people can have a pretty breast if you simply remove the implant. So we talk about it as an option, but we rarely have people take that option. What's more common is this: to come in and have your implant removed and then do a lift. The issue is you have to have enough tissue to do a lift with. So the way I explain to patients is, if you're an artist and you do sculpture, if somebody gives you a little handful of clay, you can't make much. If they bring you a big block, you can make a nice statue. If the patient doesn't have any breast tissue, there's nothing to build. So you can't lift nothing. You have to have something there. And so what we try to establish during that consultation is, what is the ratio of breast tissue to implant? So if we look at somebody's breast and say, well, you're 90% implant, that means there's really nothing to work with. And so you might want to remove and lift, but we're not gonna be able to really do that for you. If you have a large breast and 40 or 50 or 60% of it is breast tissue, that means, okay, there's something we can work with. One scenario that works out kind of nicely for some patients is, for people who come in with saline implants, we can always offer to deflate their implants in the office and actually show them, this is what you have left after your implants are deflated. And in some of those people, we can demonstrate, look, you actually have a substantial amount of breast tissue, then we can take that breast tissue and sort of pinch it together and show them what that result might look like and give them some confidence that, hey, this is a reasonable outcome. In other patients, it really helps prove the point, you don't have any breast tissue to use. If we try to do a lift, it really shows them that it's not an option. And so for those people, the option we present them is, why not remove your implants and just downsize? So maybe a person's walked around for 10 years with 600cc implants, they decide, look, they're too big, they were fun at a certain age, now it just doesn't make sense for me. Okay, fine, let's downsize you from a 600 to a 300, something more conservative, and then we'll take the loose skin that results from that downsizing and we'll tailor it via the mastopexy to fit that smaller breast. And I would say that we do that far more commonly than just removal and lift, or just removal and lift, because again, implants start with the premise that people don't have enough breast tissue, they don't have as much breast tissue as they want. So removal and a lift is absolutely an option, but we probably do that maybe 10% of the time. And the rest of patients, because of the lack of breast tissue, it's removal and a downsize with a lift.